Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. The headline was hard to miss. Dozens of people sickened by exposure to puppy poop. Some of them here in Maryland. Here to explain that situation and answer all of your pet-related questions is Dr. Jonathan Kaufman of Eastern Animal Hospital. Doctor, it's good to see you again.
Nice to see you again, Jeff.
So this story about the puppies, 13 states, dozens of people hospitalized. It starts with puppies that were sold by a big pet store operation.
Right. I guess a puppy mill concept. And they were puppies that had a weakened immune system, had a pretty common pathogen called Campylobacter, and got themselves sick, and then other people as well. And
the mechanism was that the puppy would go to the bathroom wherever the puppy feels like going to the bathroom, and somebody cleans it up, or even just in handling the puppy.
In our profession, it's called a fecal-oral route. And it's disturbing when you break that down, because it means that someone got contamination on their hands, transferred that to their mouth, and were off to the races.
What can be done? How do people protect themselves?
Well, the biggest way to protect is disinfecting, eliminating the contaminated feces from exposure to young children especially, and then treatment and understanding how to prevent it in the pets themselves.
In terms of buying a puppy, everybody loves puppies. You love puppies.
Sure.
Somebody's buying a puppy. Where would you advise them to go?
We recommend people to go to great efforts to get the best puppy from a private breeder who really specializes in that breed, to go to any lengths to get a well-bred pup. It will make a big difference.
And then in terms of the steps you take to make sure that the puppy starts out healthy, doesn't have any...
self-serving, but you go to your veterinarian and have them examined, have a stool sample sent or intestinal parasite screen, which would look for some of the common abnormalities in their parasites, and bathe your puppy regularly. We're really moving away from the misconception that we don't bathe them. It's good to bathe them in safe shampoos. It decontaminates them from the little cysts and bacteria themselves. And keep them on a good diet. There's many things you can do.
Yeah. Let me remind our viewers, if you have a question for Dr. Kaufman about any pet-related issues, talking about dogs and cats, I suppose, give us a call. We'll have the number on the screen. You can also tweet your questions. Twitter address is @MPT News. You brought with you a probiotic, which is really interesting. So a lot of people are taking...
An example of a good pet probiotic. We're recommending this at our hospital. It is, in each capsule, 9 to 10 billion bacteria that are the healthy bacteria. And the concept of this is really, it's quite simple, that the gut is an organism in of itself, and it has billions and billions of healthy bacteria that make a healthy GI tract. And when we're in a disease state, it shifts, and bad bacteria start to grow and proliferate. And that is what would cause signs of diarrhea, signs of other GI upset. And that if we can get them back to the healthy bacteria, it will make them feel better. The problem in this is a lot of the therapy involves antibiotics, and those antibiotics kill the bad bacteria as well as the good. So we're trying to use them very carefully now.
I mean, that's a big point of emphasis for physicians treating people, to limit the use of antibiotics. Why would it be a concern with pets?
It's the exact same thing. If the GI is healthy with the right kind of bacteria, your puppy will grow and be healthy, have normal stool, and thrive. If you get the wrong kind, then they will have chronic problems. And one of the things in this bacteria, this infection we're talking about with Campylobacter, is a diarrhea that doesn't resolve. In young dogs, usually in the spring and the fall, it affects them more and it's with young dogs that the diarrhea just persists, even with treatment.
And this was antibiotic resistant
Some were
form.
antibiotic. There's a high degree, between 18 and in some cases 90% of bacterial resistance in Campylobacter, and that's why we have to use some drugs that we really haven't used in a long time.
Not surprisingly, a lot of people want to talk to you. Let's start in Baltimore City with Michael. Michael, thanks for the call. Go ahead.
Hey, Michael.
Yes, I have a 5-year-old Rottweiler, a male. And what is the sign of kidney failure?
Kidney failure, the first thing you would see is increased thirst, increased urination, and then as the kidneys really begin to need help, there can be vomiting. So those are the things you need to look for.
In your I'm sorry, go ahead.
Hello?
Yes.
You're on.
Yeah, so if he's drinking a lot of water and urinating, that's the sign?
It can be. Big things you would want to differentiate would be diabetes versus kidney disease.
Is feeding dry dog food a problem?
No, it wouldn't in of itself be a cause of that. There are many other causes for kidney disease in dogs.
Thank you very much for the phone call. Just in general in the practice, what are you seeing more of? Is there any trends?
Right now we're seeing, this was a summer and fall of tremendous numbers of coughing dogs. We just saw an inordinate amount of coughing dogs, a lot of diarrhea and vomiting. So that was our big push this summer. And we are seeing fleas like we haven't seen in a decade, with a lot of flea resistance to typical products they get in the store. I don't know if other people in the area have noticed that, but flea problems that are really significant.
Let's take a call from St. Mary's County. This is John. John, thank you for the call. Go ahead.
Yes, hi there.
John.
I have sort of like a two-pronged problem with my dog. My dog has been experiencing like the last few months. You did touch on it just briefly a moment ago. You've seen a lot of this coughing with a dog, but the first part of it is just as important to me, is that he's lost his voice in the last few months. It used to be like a steady, good barker at dogs and people, and now when he goes out, I take him for a walk every day, and he goes to bark, and it's like, oh, it's a very, very hoarse and weak voice.
What kind of dog, John?
Yeah, he is a mixed beagle, mixed beagle terrier.
Okay.
And there was a second part?
Oh, yeah, the second part is also related to what you may have, you did mention just a bit ago about the fact that he's doing a lot more coughing than he used to.
Yeah.
Over a course of time, he's coughing 5, 10, 15 times a day versus like maybe on an occasional basis. Now, I just wonder if those two items are related. Are they two separate ones, or what could be wrong, I wonder?
John, we'll get you an answer on the air. Thanks very much.
So I would think that they're probably related, and this again, with a veterinarian to do a really good physical exam to try to get to see what's going on in the back of the throat, the pharynx. There can be allergic causes of coughing in dogs. There can be infectious causes. They have vocal cords just like we do. If they become inflamed, then the sound will change. So it's something that it can sound even extreme, but these are situations where I recommend even the use of a sedative to completely evaluate the back of the throat, since we don't get dogs to sit there and go ah a lot with not a lot of success. So I would really recommend having that looked at. Also evaluate the heart very carefully.
For pet owners watching, how much contact should the pet have with other pets? If it's dogs, do you want them at the dog park a lot? I mean, there's some benefits. We were talking about all the biology of the gut in animals.
I'm not big in losing the quality of life in order to be in an ideal environment. So one of the first questions I was asked a long time ago as a vet is that a guy's lab loved to go swimming and would occasionally cut its paws, and asked me very sincerely, should I ever let him go swimming again? And I was like, hell yeah. Like, it's part of life, and I think all of us have lived you can get some scrapes and bruises, but it's worth it. I think dog parks are an incredible way for dogs to release some energy, get exercise, and yes, you will pick up some contagious diseases, but in the end, as long as they're well vaccinated and cared for, it can be worth it.
Call from Baltimore County. This is Valley. Thank you for the call. Go ahead.
Why doesn't the doctor recommend getting an animal from the Humane Society or such places?
Thank you very much. You didn't say not to.
Oh, no, I'm a big, my whole life we've had rescue dogs. I'd say that puppies are a rarity. So then in the specific of getting a puppy, it's more difficult, but I think all of the shelters do a great job and have wonderful pets that need homes.
What's your inventory of pets at the Kaufman home?
Well, so 2 years ago I lost my 2 big rescue dogs, but right now we have 3 others. 2 are rescues. One is a French bulldog who we finally broke down, and we love our Willow.
Wow. You know, it was something I wanted to talk about the last time you were here last year, and we started the program talking about puppies tonight, but the other end of a pet's life. You said you lost your 2 big rescue dogs, and for the average pet owner, it's really tough. It's traumatic, and you don't know when to make that decision. You're a vet. Is it any easier?
It's not any easier, and we have now regular seminars in our hospital for grieving and for loss within our profession, because it's something, veterinarians have a high rate of suicide. It's something we deal with a lot, and how to be able to talk about it, how to deal with it, how we as veterinarians and professionals empathize with owners, but we have to carry on and see the next patient. So it's something that I think we've really grown a lot in being able to express those feelings, working with counselors. And I encourage owners to do the same. Many owners will kind of get shunned and be felt if they lose a pet. What's the big deal to talk about it? It's a huge loss of a family member, and there are professional organizations. We've created a grief wall at our hospital where we have resources now for people to call and speak to counselors, and it's very helpful.
So for the veterinarian, it's not just another procedure.
Oh, it's...
No matter how long you've been at it.
Not, for me, 30 years, and it's still just dreadful.
How does somebody know when it's time? I mean, the end of life. What I've seen various times, it sort of becomes obvious, even in the absence of some acute illness. But still, it's a tough decision.
It's a tough decision, and it's a personal decision. And I've always felt in my career that it's not what I want; it's what the family wants. We do require that there be a valid reason to consider end of life, that it can't be done whimsically or for convenience in any way. I've never done that my whole career. But at the right time, different people understand what's right for them, and some, to get an additional month is very meaningful. I've had so many families that the pet belonged to a deceased mother or father, and this was their only sort of link to them, and the time really mattered in order for them to deal with it. And then we sort of shift into hospice care, keeping pets comfortable and dealing with their illness, and everyone's an individual.
Let's go back to the phones. Baltimore City, this is Mary. Mary, thank you for the call.
This is Mary Ward. I'm calling. I have 2 cats. One has upper respiratory infection. The other one has a tooth that's rotten.
Okay.
And I wanted to know, I'm on pain medicine. Would it be all right if I give the one that's in pain a half a tramadol?
No. It would absolutely not, right. So the dosage that would be required for your cat, if you think about it as a person, average person is 130 pounds, average cat is 10 pounds. So you really can't do that safely. They metabolize the drugs differently. I think that's something that you can easily get from your veterinarian, excellent drugs that are safe and could help in a much more effective way.
And there's some human stuff, even over-the-counter drugs that we think of as being pretty harmless that are not for pets.
Well, one thing that was an interesting point about going back to the diarrhea in the dogs and the puppies, in human conditions, it's very common to stop diarrhea, to use anti-diarrheals. We never do that in dogs because in order to stop that process, the bad stuff from getting out, you can really cause them a lot of delayed illness. So it's a very interesting point that it's not recommended to use Imodium on your dogs or anything like that because it can make them much sicker.
When the caller's cat dealing with a respiratory infection.
Upper respiratory infections
You were telling me you're looking at the use of antibiotics differently.
Yes, so we now, like at Eastern Animal Hospital, we rarely treat a cat with an upper respiratory infection that's viral with an antibiotic. We support them. We do things to help stimulate their appetites. There are new drugs that are available. But we don't treat a virus with an antibiotic because it doesn't make sense.
And there's the issue with the resistance of different bacteria to antibiotics.
Correct. And mainly that if you have a cold, you're not going to get better with an antibiotic.
Let's take a phone call from Prince George's County. This is Jim. Jim, thank you for calling. Go ahead.
Thank you. Hi, doctor.
Hi.
I have a Catan de Tuliar. He's about 21 pounds. And he suffers severe itching, which our vet has attributed to allergic symptoms. And they have been giving him shots called Cytopoint for the itching and allergies. What is your opinion of these new types of treatments for allergic reactions in animals?
So it's a great question. We love Cytopoint because it is sort of the next generation of approach to itching in dogs. It's really a biologic. It's not a drug. It's not metabolized by the body. If used properly at about a month interval, it will really stop itching. It's very important to understand, though, that if we don't deal with underlying infection, that the itching will not get better. So it's important to bathe your dog, to use an appropriate, in this case, antibiotic for deep skin infections. And the combination of that with Cytopoint, we've never had better success in a safer way. Great product.
You were saying you're seeing, or have been seeing more flea and tick issues. What's the state of the art in terms of preventing that?
Well, now in dogs, the state of the art are using these new products, which are monthly or every 12 weeks, Simparica, Bravecto, which really have just changed the whole way in which we control them. Cats become more difficult because they're still topical products, and we prefer Revolution. We've had to have some people with severe infestations use them a little bit, regularly, on time, making sure they're very safe with the application and doing it properly.
If a pet's outside a lot, picks up a tick, is it different removing the tick from a dog than from a person?
No, it's the same. Even though I think
you can't explain what you're doing.
As I explain to my clients every day, they walk in and their pet gets tested for Lyme disease in a very sophisticated test, which we have the results in 5 minutes. They get vaccinated for Lyme disease, and they get a really incredible state-of-the-art preventive. And the person gets like a rubber band around their pants leg and good luck. So the dogs have it much better than we do.
Interesting. Let's take a call from Baltimore City. This is Arthur. Arthur, thank you for calling. Go ahead.
Arthur.
How are you, sir, this evening? I have a question or comment for the doctor.
Please.
And perhaps if he can make a suggestion through his professional association or et cetera. That is, there's two issues that came to me in the last few years. One, I was involved with a person who was homeless due to no fault of their own. The building collapsed in which they lived. They had a dog. Red Cross put the family up temporarily. but there was no place for the dog, no way to handle the dog. I took the dog for a while. I found out with the Humane Society and with other organizations, you have to give the dog up for adoption. They will not take it for foster because of liability. The second issue I had found, and I do work with therapy with animals and people, and what I found is that poor people who have service dogs, there is no, at least there's none that I know of, sliding scale for veterinary services for a poor person who has a service dog.
Okay.
And they have to give up the dog if the dog gets ill.
Arthur, thank you very much for the phone call. So let's start with that. So somebody...
I think during this hurricane season, we saw a definite increased sensitivity in shelters being allowed to bring in family pets as well as the family members, and I think that's really important. I know that this is an evolving process, and certainly to us at our hospital, pets are members of the family legitimately, and we would do anything. We've had many cases of people who've had fires and things where we've worked with them in order to house their pets. Sliding scales become, I think veterinarians across this country are some of the most generous people, and it wouldn't surprise me that everyone listening has had an experience with their veterinarian or has sat in their office when someone has needed help and gotten it. So I'm confident that can go on.
Is there any sort of clinic? Is there a veterinary school here?
No, there's no veterinary. There's one in Blacksburg, Virginia.
Yeah.
But there are some some supported wellness centers. There's the SPCA has one on Falls Road that is a reduced rate wellness clinic that could be worth checking into.
Let's take a call from Baltimore County. This is Jody. Jody, thank you for the call. Go ahead.
Hey, Jody.
Hi. Thank you for taking my call.
You bet.
I have a serious question. I have an old dog, Yorkshire Terrier, and he's in his last stages of life. He's 13 and a half years old. Back in May, he started losing his hair on his spine and his feet, and he's just going downhill. He eats like he's starving to death, and yet he's lost weight. He's lost more than half his body weight. He went from 9.9 pounds in May down to about 4.4 now.
Wow.
Because I have seen vets and nobody knows what's wrong with him. They've tried many things. Excuse me. But since he will have to be put down, I understand that this is not about a life extension. Because I know he's old and he's blind and he has other problems. But when he dies, I'd like to have a board-certified forensic pathologist do an autopsy to find out exactly what was wrong with him, because nobody seems to know.
Interesting, Jody. We'll get you an answer on the air. Thank you very much for the phone call. Good luck.
We are very fortunate to have Johns Hopkins University Department of Comparative Animal Pathology here in Baltimore, and they will do that, and they do it an incredible job. The biggest issue we have is you can't receive the remains back. And for that reason, a lot of people opt to not do that. But most veterinarians can get you in touch with them. So Johns Hopkins University Animal Pathology.
When people, for whatever cause, bring a pet to your office, what are some things that they do right, things that maybe you'd wish they did something differently?
Well, I think probably the biggest thing is knowing how to work with their dog. And we're not as focused as much on training them in the old way, but just making them good citizens.
Or the pets?
Yeah, the pets. And so we'll get dogs that have a lot of behaviors. We're focusing now on trying to reduce fear in all of our patients at the hospital, because that, once there's a fearful response, it sort of spirals, and I think there's great new approaches with that. That and nutrition. I mean, cats are just routinely fed all the dry food they can leave down, and it shouldn't be done. They should eat canned food twice a day and limit their dry to just about nothing. dogs are generally fed foods that are not so good for them and too much. So it's really worthwhile going to an independent pet store, not one of the big chains. Walk around and look at some of the food options that are available, and that would be a big help to us.
Any particular brands you like?
We feed Veris, the hospital. It's a Maryland company. We love it. It's a great quality product. And then some of the other, they're more, they're harder to find from. FROMME is a wonderful small batch food that's really, really high quality. It's great.
But it's easier for people to get the giant bag from the Costco.
Right, and those ingredients are like feeding fast food to your pets 24/7. It's tough.
Dr. Jonathan Kaufman of Eastern Animal Hospital, it's been fun visiting.
As well, you too, Jeff.
We appreciate the time. Thursday at this time on Your Money in Business, how a Maryland animal shelter is helping displaced pets and their owners, and what the trends say about Maryland's economy heading into the new year. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching Direct Connection, and have a good night.
This program was made by MPT to serve all of our diverse communities.